Mr. Fombad Mujem is a citizen of Cameroon and he is a lawyer by profession, has his own law firm there. And one day while he was working, he suddenly had a very severe headache and dropped unconscious. He was taken to the hospital there and investigated, and he was found to have some amount of bleeding in the brain, which was diagnosed as subarachnoid hemorrhage.
So my medical problem started on the 16th of March at about 11 p.m. in the night. When I was sleeping, I developed very violent headache. I decided to take some painkillers myself and I slept, and the following day I didn't go to the hospital. I instead traveled. That was some negligence on my part. I traveled out of town for an occasion and I came back. The headache just only reduced, it didn't subside, but 3 days after I started feeling violent pain at the back of my head, and then it went down through my spine up to the back, and then the pain went down right to my legs.
He required closure of the aneurysm, as these lesions are such which, when they rupture, carry a very high mortality. And it is like 40% of the people with aneurysmal ruptures may not make it to the hospital in the first instance. And second time rupture even carries a higher morbidity and mortality.
I'm Wande Salomon. I came to India to accompany my husband to do a head surgery. And initially I was so scared, very scared before coming here. But our reception from the airport to the hospital straight gave me the impression that I was at the right place at the right time.
I had very positive feedback, and that's how I decided that I was going to come over to India for treatment at Max.
After that, once we had secured the parent vessel, which was again ectatic, we were able to localize the aneurysm, define it, and were able to clip it while saving all the parent vessels and the supplying vessels nearby. His post-operative period was quite uneventful, and after 5 to 6 days, he was discharged from the hospital. And now, his stitches have been removed on the 9th day, and he is now set to fly back to Cameroon. So that was a very happy outcome for him, and when a patient is happy, we all are very happy.
Subscribe to our YouTube channel and press the bell icon to get the latest healthcare updates.